morning, everybody. Today is 4th month anniversary when Greed from HCA came to San Jose on February 13, and they slapped RMC, MEC. You can imagine we were in a meeting with our, president of the medical association there, and then they announced they're going to close down trauma, and he is trauma surgeon. So that was a big slap on the faces of the physicians there. Then they slapped people of Santa Clara County, and they said, we don't care about DEI. So people who don't know what DEI in healthcare stand for, it is diversity, equity, and inclusion. Then they went and they said, we're going to slap state. And the reason is there are 85 hospitals in the state for which RMC is to go place for transfers for trauma care. And then in the sense, they also slapped the whole country, telling them a message: we are for profit, unregulated industry, and would do whatever we can do to increase our $5.2 billion which we made last year. This is a huge statement which happened on February 13th. So let me talk about what is health inequity. Look at this regional medical center. We serve about 1/3 of the population of East Santa Clara. 1/3. The other 2/3 is on the west side. And if you look, they have 3,000 beds. We have only 258. If you take equality, we should have 1,500 beds. We have only 258. Just 258, right? This is the lifeline which will be cut short. Right? Now, look at the diversity. Majority of the population around regional, Hispanic, 50 to 60%. Rest Asian. Very few white people. They have difficulty speaking English. They have difficulty getting the resources. They are scared. Some of them, they don't know how to use a phone. I went for the campaign and I was surprised, how many people, they don't know how to use a QR code here. So that's what we are representing. Now, what will be the impact of this closure? There are 5 levels, and if I give you a helicopter view, I'm going to divide into 5 different levels. Level 1, EMS transport. Imagine a critically sick patient with a fatal gunshot wound or mass casualty being transported from here to Valley, which is 15 minutes away. It can be life and death. And if Valley is full, where is it going to go? Going to go to Stanford, which is about 33 minutes away. This every minute counts. Now, same thing about stroke. Comprehensive stroke. Every minute you lose about 1.9 million neurons, and this can be life and death situation. And same thing for the heart. The first 30 minutes is very, very important in heart attack, and longer we take, the worse it goes. So this is just a transport. Second, look at walk-ins. Majority of the patients coming to regional, they are not through the EMS, they are walk-ins. So the EMS will take them to appropriate facilities, but the walk-ins, only the ED docs will be left with them. Now imagine, if you have a heart attack, stroke, and trauma in the ED with no specialty support, what's going to happen? You have to call the EMS, you have to arrange the transportation, you have to make a accepting facility. It will take hours, if not, many, many hours. Lot of lives will be lost. The third level, and a lot of people are not paying attention to it, we have almost 150 to 200 patients at a time in the hospital. God forbid any of the patient has a heart attack or stroke and they have an intervention needed. Where would those patients go? They have no place to go. Okay? So to transfer patient from inpatient to inpatient somewhere in the county will be like many, many hours. And we know the time is the essence. These are emergency medical services which cannot be compromised. Now let's look at even broader impact at the Bay Area. So when we close this trauma, heart and comprehensive stroke, all the neighboring hospitals will get an increased volume, decreasing quality and availability of services in those hospitals. But the bigger picture is even worse. Let's say public comes to know the care at regional is substandard or at times can be very risky, they may stop coming to regional altogether. Then there will be mass migration of the patients from regional catchment area to the surrounding hospitals. We already are seeing it. Pediatrics and OB/GYN are not coming here. You can imagine trauma, stroke, and heart patients are not coming here. But what if all the patients are not coming here? You can imagine what will happen to all, the whole system will go on fire. This is what we call tsunami. It will be a public health tsunami created by one particular entity, which is called SCA. And the last, I want to show the impact. Disaster management. This is the only hospital on the east side for 5-mile radius. There's no other hospital. If earthquake occurs, where do we go? We have no place to go. This is the only hospital where Tower 1 and 2 are earthquake ready facility already. I cannot emphasize more than this. You know, in case of disasters, there will be increased mortality and morbidity in this region. Now, if we say this is very critical and very urgent, at the least we are seeing 20 patients daily which will have serious harm or fatalities by just closing these 3 services. Now, there is a supervisor Samitian at the Board of Supervisors meeting on April 16. He said a very big statement, and I want to read what he said. He said there is the legal obligation of a regulatory body to exercise its authority that exists in part to render judgment about a public harm that is about to occur that is inconsistent with regulatory framework. So as a doctor, what I understand about that state has implied authority to protect the public from harm, no matter how powerful the adversary is. So we are already waiting anxiously from California Department of Public Health. It's more than 7 weeks. The Santa Clara County Board of Supervisors sent their unanimous recommendation to state not to let RMC to close. But we have not received any favorable or unfavorable decision. It is still 7 weeks. You know, it's a life and death situation going on. And what is the downside of waiting for it? The physicians, they have started receiving 90 days termination. They got it on May 12th. So all the orthopedic surgeons from UCSF, all the neurosurgeons from UCSF, Neuro IR, trauma surgeons, ophthalmologists, ENT surgeon, plastic surgeon, cath people, they have started looking around. And the more things are also very, very concerning. Equipment from the OR has been moved to Good Samaritan Hospital. So surgeons, even though they want to perform surgeries, they cannot. Surgeons are not feeling comfortable bringing elective surgeries. Another big bombshell news, Chairman Emergency Department and Chairman Radiology Departments, they resigned from their positions just yesterday. Key employees, including CFO, Neuroscience Director, nurse practitioners have been moved to Good Samaritan Hospital. And there is an active divide and rule policy is implemented by SCA. You know, the SCA CEO, Sam Hazen, he came to the Bay Area a couple of weeks ago, and he did not come this part of the city. He went to Good Sam and announced $1 billion investment. But we are happy for Good Sam, but we condemn the gross apathy and neglect of the RMC by SCA at the highest level. I mean, it is unethical, it's irresponsible and shameful to tell Santa Clara County residents that we will provide state-of-the-art modern medical services only to the rich neighborhood at the expense of cutting down life-saving emergencies to the less affluent, diverse populations. They have forgotten that RMC and good SAMs are the children of same parent ICA, and they will not succeed fooling all the people all the time. We work in both hospitals. We are brothers and sisters. You cannot divide us. So keeping in mind, we started this public petition requesting state to stop closure of these programs immediately on May 24th. And at present, we have more than, I think, 5,200 signatures. The petition is endorsed by majority of the Medicine Executive Committee at RMC, 62 prominent physicians in the community, including 5 former president of staff, 12 community organizations, including City of Morgan Hill, and many prominent citizens. Our goal is to reach 10,000 signatures, and once we have required signatures, we will go in person and deliver hand to Honorable Gavin Newsom, our Governor of California, Rob Bonta, California State Attorney General, and Thomas J. Arrigan, Director of CDPH. At this moment, I will like our elected officials and Governor to remember a famous quote by President Abraham Lincoln, which he gave almost 161 years ago, November 1863. And he said, it still resonates here: democracy is the government of the people. So democracy is the government of the people, by the people, for the people. We should not let lobbyists, corporate lawyers, and rich corporations to crush people's voice. We really look forward to your exemplary leadership. And I'm going to end by another quote which is very dear to my heart. This is the quote by Martin Niemöller, and if you don't know about it, he's a German pastor, and he was one of them who was with Hitler at the start of the Nazism, and later on he became a fierce critic and he was in jail. And this is a very, very, I think, appropriate quote about guilt and responsibility. So he said, first they came for the socialist, and I did not speak out because I was not a socialist. Then they came for the trade unionist, and I did not speak out because I was not a trade unionist. Then they came for Jewish, and I did not speak out because I was not a Jew. Then they came for me, and there was no one else left to speak for me. Now, how does it translate to us? Look at, about 10 years ago, they closed down pediatrics. We all did not speak. All the pediatric patients for emergency, they have to travel so far. About 4 years ago, they closed OBGYN. We did not speak. About 2 years ago, they closed nephrology and TI services. We did not speak. No, they're going to hit on critically important emergency services where every day a lot of patients will be hurt or even killed. I think it is duty of public to speak out. Don't be complicit in the wrongdoing of any organizations. We humbly request public to sign the petition, share with your family and friends. Let's affirm our faith in 2 basic principles of medicine: save the lives and do no harm. Thank you very much. And I will introduce our next speaker, a registered nurse at Regional Medical Center, Melissa Gong. Thank you.